morning. Hello, everyone, and welcome. We're going to do a presentation this morning on completing a Medicaid application. So this is the beginner's guide to ABE and Medicaid. My name is Rita. I'll be one of your presenters along with Haley. Okay, so a lot of you guys are probably already familiar with BEC, but we're just going to go through some explanations of what the program entails a bit and just give you kind of a general synopsis of what we're going to be doing today. So what is BEC? So BEC stands for Benefit Enrollment Center, and our team aims to provide application assistance for public benefits, help people understand their benefits and advocate if needed, and conduct outreach to educate the public regarding the program, as well as support other benefits counselors in our aging network. Another feature is housekeeping. So please make sure to stay on mute if you are not speaking. Also, content questions that arise throughout the training can be submitted to the chat. Stella, an advisory training specialist, will be answering questions as well. And slides and toolkits were sent via email this morning to everyone, so recordings will be shared afterwards. The goal of this training is for pretty much Medicaid 101 for beginning Medicaid counselors, for those who are kind of still wondering how to work the programs, how to, I guess, assemble the applications or do them with the actual clients. Also, practical training is offered from the perspective of a benefit counselor. Introductory instruction on how to complete an ABE application as well, to introduce the specific language used by key stakeholders, and basic introduction to the Illinois Medicaid system. So this is one part in a series of introductory trainings that we'll be conducting. The agenda. So the Medicaid overview is what we'll be doing, the Illinois Medicaid enrollment process, as well as the ABE application, submitting documents, managing my case and redeterminations, as well as troubleshooting if there's anything that goes awry. So let's do part one, the Medicaid overview. What is Medicaid? So Medicaid is a health insurance program for people with low incomes who meet the income and asset tests. So it's funded by the federal government as well as the state government. And a difference, what is Medicare? So Medicare is a different federal health program, coverage program, and is often confused with Medicaid. Now, Medicare is a federal health coverage program for older adults 65 plus, and some people with disabilities with a qualifying work history. Some people have Medicare as well as Medicaid. If someone does have both, they are referred to as dual because they are dually eligible for both programs. So we have here the key government stakeholders. So at the very top of this pyramid here, we have the Health and Family Services, which is HFS. And HFS, the state government body making the policy decisions. Right below, we have the Illinois Department of Human Services, which is IDHS. And IDHS is the government body that administers the benefit and processes the applications. And to your far left, we have the Family Community Resource Center, which is the FCRC. And FCRCs are a subsection of IDHS, often referred to as a local public aid office. This is the physical place that an application gets sent and processed. Sometimes people prefer to do that method as far as some of the callers who call in or any clients that you may be dealing with. There's also the Family Community Resource Center, which is the FCRC, as well as the Family Community, I'm looping, they're all FCRC. And then there's the local office, that's the local office administrator, LOA. And the local office administrators run the local office similar to an office manager. And then we have the sector for caseworkers. Now, caseworkers receive applications and approve and deny benefit applications based on requirements. So we have a map here of the FCRC offices. You can use the IDHS office locator to search for exact addresses. There's a link here that's in the actual slides. I believe it works, but that is where you'd actually find on the locator to search for exact addresses for the actual offices in the neighboring neighborhoods. Eligibility. All Medicaid programs are means tested, meaning that applicants must be below a certain gross income limit to qualify. Immigration status, household size, and assets are other factors that can affect eligibility of Illinois residents. And eligibility amounts are based off the federal poverty line, so the FPL. And FPL limits are raised every year. Medicaid FPL increases typically go into effect in April. Immigration status and eligibility. So lawful permanent residents, so LPR for short, living in the U.S. legally for 5+ years, or non-citizen groups that include refugees, asylees, U.S. military or veterans and their dependents, as well as battered non-citizens, spouses, children, or parents. We have the Illinois Medicaid programs for non-citizens. So health benefits for immigration adults, so HBIA, Medicaid coverage available for adults 42 to 64, regardless of immigration status. The program is ending as of July 1st, 2025. So it will be ending very shortly, very soon. Health benefits for immigration seniors, so HBIS, Medicaid coverage available to adults 65+, regardless of immigration status, and enrollment currently paused for the time being. Emergency coverage for non-citizens. So emergency coverage is available for non-citizens that do not meet immigration eligibility requirements. Then there's the gross versus net income. So all income reported must be gross income. The gross income before deductions, and the net income is after deductions. So lots of people will often ask, is this based on gross or net? This is what I bring home. I don't actually get to see that. This is what they're referring to. If someone is working, you need their income before taxes are taken out. So if someone is receiving Social Security benefits and has Part B premiums taken out of their check, refer to the amount earned before that deduction. So there's a chart here that has like an example of what that might be. Hopefully you all are able to see that. The 2025 important Medicaid income limits. So there's the ACA adult Medicaid. So there's a chart here that shows what the monthly income limit or threshold is and the asset limits. So there's one for AABD Medicaid. So for seniors or adults 65+ and adults who have been approved for Social Security or disability, there's income limitations as well for that one, as well as the AABD Medicaid spend down. So for those who are told you can qualify if you're on a spend down, that is the actual income limit listed for that one as well as the asset limits in the final column. And AABD income limits include 25 disregard. ACA income limits include a 5% income disregard, as well as income limits updates on April 1st to reflect the current year's FPL. And then there's the Medicaid enrollment process or cycle. So the first step would be complete and submit an application. The second step would be to upload the documents. And then the third step would be to receive the decision. And then the fourth step would be the redetermination. So we're going to go to part 2 of our section here. It's the ABE application. So creating an account is the first step for completing the ABE application, as well as the general information, identity proofing, health coverage, disability and unpaid medical bills, assets, income, additional information, submission, as well as uploading the documents. This is all part of that process. So what is ABE? So ABE is the application for benefits eligibility, shortened to ABE. This is the state of Illinois' official platform where individuals can submit applications or inquire about the status of their cases for the following public benefits. So for Medicaid, we have the low-income health insurance, as well as SNAP. This program helps pay for groceries, is also known as EBT, link, or food stamps. Then we have TANF, AABD, cash, so a cash benefit available to people with very low income. And then there's the Medicare Savings Program. We have 3 benefit programs that pay Medicare Part B premiums. So one MSP program, the Qualified Medicare Beneficiary, which is QMB, also pays Medicare Part A premiums and Medicare cost sharing. Now, Age Options does not train on AABD, cash, or TANF, okay? So we got benefits to applying with an ABE account. The applications are much easier to track as there is a record of all submissions and Manage My Case. Faxed or mailed applications run the risk of getting lost, okay? There is no record of what was listed on an in-person application. The platform does offer a secure way to upload documents, and we strongly recommend applying with an ABE account when possible. There are many barriers to the online ABE platform, but it can be a useful tool when you're able to utilize it. And then we're going to go into intake information. Just a little disclaimer here, there's additional information may be needed if you're applying for additional benefits, okay? So proof of identity found on a driver's license or a state ID, full names and date of birth for everyone on the application, as well as social security numbers for everyone applying for benefits. Alien registration number for any person who's applying and not a U.S. citizen. Information about gross monthly income for everyone on the application. Information about health coverage through work, if applicable. Value of everyone's cash, checking, savings, and or other type of bank account, or any other type. General information about any vehicles, real property, life insurance, and burial resources for everyone in the household, as well as medical bills for the past 6 months, if applying for the Medicaid spend down. And then here's one of the home screens for a screenshot of actual ABE website itself. So this is a welcome page where you actually can see what actual benefit you like to apply for, whether it be managing your case, checking if you should apply based on the requirements that are listed there, as well as the apply for benefits. So on the home screen, the first things to learn, which we're going to go into a little deeper detail now, check if I should apply. So the benefit screener. So this tool is to help determine what benefits the household may qualify for. The second is apply for benefits, and 8 provided login community partner registration. So there is where the application is for LINK, SNAP, Medicaid, Medicare Savings Program, or cash benefits. And then manage my case. So let's say you already created an ABE account and you just want to do some research and check on the status of your case or a client or caller's case. This is where you would go. The portal allows you to view the status of any existing benefit case, as well as apply for new programs, file redeterminations, and report any changes. The login screen. So all users of ABE Illinois.gov are required to create an Illinois login account with the state of Illinois and an ABE profile, pardon me. You can create an Illinois login account if you don't have one. So that's the first section there at the very top for those who have not ever used the ABE website. That's what you would utilize. You can also connect an ABE profile as well as ABE sign in. So you already have an account, you're able to sign in just fine. In most cases, when working with a new client, you will begin by creating an Illinois login account. So that's where you apply for benefits. And if the client's not able to establish an Illinois login account, you can apply without an account. So it can be a little tricky, but this is where you would go. And then you can proceed without an account. So you can apply for benefits without an account. We recommend that you do use the Illinois login account so you can save your application progress just in case you're accidentally bumped out of there. Also, you can return to the application later if you have to go for a pressing meeting or something. The caller has to go as well. Or you can return to see the status of your application that you submitted. And you can also upload proof documents because that's very important for those who there's definitely a time restriction there on when those documents have to be submitted and uploaded. And after selecting to apply without an account, just a disclaimer here, you will see this pop up. So it'll show you apply for benefits without an account. So make sure you click the blue hyperlink at the bottom to be directed to the application so that you can actually look at those functions that are listed in that box. Then we have creating an iLogin account, so the Illinois login account. So the first steps, this is where a lot of us get thrown into the loop-de-loop. At least I can speak for myself personally. This is the first step here. So it is a two-point authentication. I believe that's the word I'm supposed to use. Process for actually logging in. This is where a lot of our callers get stumped, as well as some of our specialists as well. So the first step is to sign in. So you're going to do the email, create a password. They're going to ask you some security questions and things that you can easily remember or you feel most comfortable with. That's what you're going to use to enter this login account. And then you're going to be able to sign in. So hopefully you're able to see that. I don't think I can make it any bigger. But they're going to ask for 8 characters when it comes to the login. So they're going to be a combination of lowercase, uppercase letters, as well as some symbols in order to enter that as well, so that it can be more secure when it comes to logging in at future dates, future time. A lowercase letter, uppercase letter, a symbol, number, no parts of your username. You can help it. And it does not include your first name. It does not include your last name. Okay. So anything without that, I know a lot of people prefer that method because it's a lot easier, but you want something that's a little more secure. So you're going to enter the client's email name, create a password. Do not enter your email or someone else's who may use iLogin in the future. Also used for ss.gov. So ssa.gov, that's the reason why they don't want that. So only one account can be attached to an email. And then the next step is the setup. So you're going to select setup under email. So select email if shown, plus at least one other security method to access your state of Illinois iLogin account. So this is that two-point authentication we're talking about. You're going to make sure this is where the loop-de-loop kind of happens, where most people get kind of stumped. This is what you do. So you can use several methods. They have the Google Authenticator, they have email, or you can do Okta Verify. So there's 3 different ways if you'd like to enter it that way for the second part of this process. Next, you'll be directed to select the security method. So these are the methods. All accounts will be required to set up an email. After clicking setup, you may enter the client's email and password. Most of the time, I highly encourage them to already have that set up prior to you setting up the appointment with your client. So you can have them kind of test base beforehand. That way, if family members can assist them with the process, they can. And that way, we're ready to go when it's time to apply. But if they prefer to do so themselves, you can do so over the phone with them and walk them through the process if they are privy to it. And then enter the code sent to email. So oftentimes, another question I was talking to my co-presenter today about this, or the other day, I'm sorry, regarding having a little bit of a little kind of preface for when we have the actual appointments is to make sure that they have access to email, have access to internet, because without those things, they will not be able to apply for the applications online. So make sure they actually have access to email and internet in order to access the code so they can deliver it back to us so that we can actually apply in the system with helping with the application online. So an email will be sent to the client's email address that will include a code, and you're going to enter that code on your screen. Once you're able to enter that code on your screen, you should be able to log in. And then they're going to ask the security questions. And this is the last part. I believe it's kind of a multi-step process, but this is one of the other parts where people sometimes forget. Setting up a security question so that it's not as easy to kind of hack into someone's account. And this is one of those methods here. So the security question, the client can opt to set up the second security question by phone, security questions, or authenticator apps. So as a caseworker, it can be helpful to use security questions to avoid having to contact the client each time we access their account. So this helps when you do want to reference what's going on and check the status or updates on your account. So definitely want to keep that in mind. And then you want to connect the ABE profile. So a lot of times there is a loop here as well where there is a bunch of things happening when people try to connect the profile and take you for a run or a loop. This is one of those things here, is connecting the profile. It will make things a little simpler. Once both your security methods are verified and in place, you'll be directed back to the login screen to connect an ABE profile, which you'll do. Hopefully by then you'll be able to get in. And now we're at the Connect an ABE profile. You're going to enter your user ID and password that you've created or the client has created and provided to you. And if the client has a previous ABE profile, you may enter their user ID and password. Now, if the client does not have a previous account, click the blue hyperlink at the bottom to create the profile. Now, when you're entering a previous profile, you may encounter an error. Click the blue hyperlink to bypass the error portion. You should be able to bypass that. Then we have select start a new application to begin. So if you're starting from scratch, you're going to click here at the very top where it says start a new application for healthcare coverage, SNAP, cash assistance, and Medicare savings program. And then keep working on an application that you have already started. And then check the status or view an application that you've already submitted. Manage my case or file or manage an appeal if worst case scenario, their applications rejected or denied. And you only start a new application if the client is certain neither they or their spouse has Medicaid, SNAP, MSP, AABD, cash, and therefore do not have an active case with FCRC. That's the only time you'll start a brand new application. Otherwise, they will already be in the system and it will pull up information from a previous attempt to apply for benefits. And then you're going to scroll down to the bottom and click next. So right here at the bottom, you click the next button because it'll tell you everything you need to do. I know it's pretty tiny, but you get the idea of how that kind of works. And then you're going to check in with your agency to see if you need to become an approved representative. So there is a section there for that, so that people can actually look out or watch out and talk to you when it comes to completing those applications in the future. And some of your organizations may have registered as a community agency, and if so, list your agency number here in this box right there. And you can click apply for healthcare coverage. So there's a couple of functions here, as you can see, and some of the mini drop downs here in this box. Now, please note, if you have your client apply for multiple programs, there may be additional steps and documentation required. It takes a little additional time, but if you're trying to help the caller, you can take the extra time just to ensure that they get all the assistance they may qualify for or may need. Okay, it's another example or just another screenshot about the benefits if they're applying for more assistance. So they're doing SNAP, they're doing cash assistance and healthcare coverage. So that's another section there. Okay, general information portion of our presentation. Okay, so we have Johnny Appleseed here, and he is going to be applying. We're starting off anew. We're going to put his information here in that box there where it says mailing address. Can be different from where you live. So you have two sections. There's where you live, and then there's the mailing address. Some people choose to use a P.O. box. Some people choose to use another relative or friend's address for the time being. And applicants can elect to go text reminders for important dates. I think this is a pretty good function for those who don't have access to the internet. They just have straightforward kind of plans for their phones. This may be the route to go. Applicants can elect to get emailed reminders that notices are available online or were mailed. So it comes in handy for redeterminations. Make sure to pause and consider how this description applies to your client's living situation. So the people in the home section here, this is something that you want to think about. So those people who are using different addresses. And
wait, let me raise my hand first.
This is what you would like to do. To complete the application and refer to the Medicaid household rules chart if you're working with the family. Requesting retroactive health benefits. Select yes or no to apply for benefits for this person. So this is something that if you have gotten to this section of the application process, If you don't see the benefit you need, you can navigate back to the apply for benefits screen and select yes to make it available. So you do have the option to go back without losing any information. If you want to apply for backdated application, for medical, that is an option as well. Clients can get retroactive health coverage for up to 3 months prior to the application date, which is really neat. These boxes must be checked off if the client wants to get backdated coverage. So this is for health benefits. If you're applying for Medicaid, you're going to select the medical benefit choice for AABD or ACA, and your client would like to enroll in. So if the person is eligible for more than one type of medical program, what would be the preference? So um, example, aid to the aged, blind, and disabled, or the family care of ACA, or no preference at all. So if you click no preference, the applicant will be screened for ACA as it has a much simpler eligibility rules for that program. And then if people have questions, myself included, the difference between ACA versus AABD coverage and why it matters. Why does it matter? So people with Social Security Disability Insurance, SSDI, can get Medicare 24 months after the disability start date. So therefore, disabled adults under 65 without Medicare are often eligible for both AABD and ACA Medicaid. So ACA Medicaid has a higher income limit and no asset limit. So if they're eligible for ACA, it'll be easier to maintain their enrollment. And we recommend you click ACA Medicaid if the person is under 65 and not receiving Medicare. So when to click ACA Medicaid versus AABD? This $1 million question. So ACA Medicaid, if you're an adult ages 18 to 64, yes, you would check that box. A disabled adult aged 18 to 64 who does not have Medicare, yes, you would click that box. Now, if you're a disabled adult with Medicare, then you would click the AABD Medicaid as opposed to ACA. And if you're an older adult age 65 plus, that's when you would utilize AABD Medicaid as opposed to ACA. So they have the stipulations and guidelines here in this box to show you when you would utilize either, okay? Tax information. So is this person planning to file taxes this year? It's a very prominent question in lots of the screening applications for lots of different things, particularly for ABE benefits. And then you don't have to answer these questions if this person is not applying for benefits for Social Security information, but a lot of times we do ask these questions as far as Social Security number. It is required for anyone who's applying for benefits. If a household member is not applying their Social Security number, I guess it does not need to be entered. So it's just for that particular person who's applying for the actual benefit. If a household member is not a U.S. citizen, you may enter citizenship information here. So in this box where it says citizenship information, is the person a U.S. citizen? You can answer yes or no. The request is for emergency medical or non-citizen. You hit no. So click yes here if they're applying for emergency Medicaid or for non-citizen. As well, is this person a documented non-citizen? So let's say yes here. They'll have all the information and document type, document number in that drop-down box. And applicants must have a green card for at least 5 years to be eligible for Medicaid. So just keep that in mind. And then there's a veteran information section. So if is or was this person in the military or a spouse or child of someone in the military. So there's a yes and no there. Race and ethnicity information is optional. Lots of people are a little wary about answering these questions. A lot of times they're afraid that this will impact their ability to apply for benefits or receive benefits. So yeah, it is optional. So if someone decides not to answer, they can say, I don't want to answer that. I don't feel comfortable. And you can bypass that by clicking prefer not to answer. If the client is living at the address they previously stated, select in this home. So in this home means the person's who's applying for the actual benefit will be the person in this home. So that's the home they're referencing is the house that they're currently residing in. So that's the primary person who's applying for the application, who's applying for the benefit. And we recommend that the beginning application, sisters contact an experienced counselor if they're helping someone who lives in one of these other places on the list, as there will be additional rules to consider that are not covered in this training, such as if someone lives in a group home or in the county jail who are applying for benefits or a shelter. Sometimes people will call. All right, sorry about that. So blindness or disability portion here. Does anyone have a disability or blindness determined by the Social Security Administration or have a disabling condition that's lasted at least 12 months and prevents the person from working? So let's say Johnny Appleseed is the person who has a disability. We're going to check that box here. We're going to hit yes, check that box. And then has anyone applied for or received service through the Department of Aging Community Care Program? Yes, it's going to be Johnny Appleseed. And the community care program is a caretaking service facilitated by the IDOA. So, and then disability information, I'll go into that section as far as the drop down box for that. More information about Johnny's disability or blindness. And we pretty much answer all those questions precisely, um, starting with everything they need regarding the SSA, and decision the SSA has made regarding Johnny's blindness and when did Johnny become blind. So they get a little specific, a little more detailed with some of the questions, but it's pertinent in order to determine if an individual is eligible for services. And I'll talk more about Johnny's disability, have questions regarding that. So they're pretty straightforward. You just answer them as best to your ability, well, based on the responses as well of the actual caller or client. And then here, let's say you are applying for yourself, but I'm like, oh, yeah, my wife is here, or my husband, or I have a sister who's staying with us. Again, it's the household memory summary. So they'll have questions to add other household members' information into the sections in the actual application process. And other household members will get asked the same questions as well. So usually it's a joint collaborative effort to provide all the information for the application to make sure that they're submitted and all the information is accurate. Now I'm going to turn it over to my co-presenter, Haley. She's going to talk about identity proofing.
All right. All right, can everyone see that? Okay, so now we'll go on to identity proofing. Okay, so at this point in the application, they'll ask you if you could verify the person's identity. So you can do that either by um, entering the information off of the person's driver's license or state ID, or you can go ahead and do background questions. So first here, we'll say yes, that we do have the person's driver's license or state ID card. So now we'll have to enter all the information on their card exactly as it is stated into this application. So their first name, middle name or initial if it's on the card, last name, date of birth, eye color, height, and weight exactly as it is stated, as well as their driver's license number or their state ID number. So an issue that we run into every so often is that it won't accept the height. So you just make sure to put a 0 before the foot or 0 before the inches if you run into issues there. But everything needs to be exactly as it is listed on the ID card or else you will not be able to verify. So a way we go around this, especially since at Age Options, we mostly take applications over the phone as you hear as reference. If we don't have that person's ID card in front of us or have a photo of it, we go through the background questions. So this is only an option that's available if the person has a credit history. The questions are quite specific. So like what is a previous phone number they've had, a previous street number, mother's maiden name, what county they currently live in. So you can verify it through this way. So if you unsuccessfully answer the questions, or if there is no credit history available for them to verify, you may see this screen that prompts you to call Experian. So you can do that, or you can also verify it manually through forms available through DHS. Okay, so next is the health coverage, disability, and unpaid medical bill questions. So previously we selected that Johnny has, oh, I'm sorry, that Johnny needed health coverage for the month of December, so he needed backdated coverage. So it's going to ask us if there's any family members that lived with him during that month of December that we're requesting coverage for, if he was in the hospital, or if he had unpaid medical bills. Just to note, if he is applying for spend down, then you would want to upload copies of those unpaid medical bills that you're referencing. Okay, and then if he has a disability and receives services under the developmental disability waiver, but not yet received benefits, this would be something you know if you're working with the client. If they have health insurance through their job, so if they do have health insurance through their job or they have been offered health insurance, they would need to accept that before applying for Medicaid. Okay, so then it's going to ask additional questions if we stated that he does have health coverage other than Medicare or Medicaid. So you'll enter the type of coverage, whether that is a health and hospital insurance that's through an employer or through a parent, workers' comp, student coverage, or another type of coverage. And then just enter basic information like the name of the policyholder, name of the insurance company. Just a quick note that Medicaid is considered the payer of last resort, which means that if the applicant has other insurance like we're talking about, then that would cover first and then Medicaid will pick up what is left. Okay, now after assets. So the way I explain this to clients is that assets refers to any money that they have in like a financial account. So here I'll ask if they have cash at home, if they have a savings account or a checking account, or other liquid resources. Other liquid resources can be hard to describe. So if you hover over that blue dot with the question mark, it'll give you examples. So things like trust or annuities, savings bonds, IRAs, medical savings accounts. And so that's a list you can go through with your client to make sure there's no other additional resources that may not have came to mind. Important note is that if you are applying for someone who is going into a long-term care or applying for a home and community based services waiver, they may be subject to a 5-year look back period, which means that they would need to show um, that they did not transfer or give away any of these assets within the last 60 months. Okay, so if you selected that they do have other liquid resources, you'll see this pop up. You'll select which ones apply to the client. So if they had a trust, an IRA, or 401k, you'll check those off here. Um, and just a reminder that all liquid resources must be under 17,500 in order to apply for AABD Medicaid. Okay, so for each of those resources that you enter, you'll see a screen like this. Well, you'll enter the balance of whatever account you selected. You'll state whether or not anything was closed, if the account was closed or given away. You'll enter for the previous month where we're asking for backdated coverage. They'll want to know the balance of those accounts during that month as well. Okay, so vehicles. So the first vehicle that a person owns is exempt from being counted as an asset for Medicaid. So if Johnny only has one car, we'll select that he has a car, enter the year, make, and model. We don't have to enter the fair market value of the car or say how much he owed. But if he has any additional vehicles, then you will need to enter that information. You'll also enter if there is any other owners on the vehicle. And again, enter information for that previous month that we requested backdated coverage. So what is the fair market value during that month of December? Okay, real estate. So the house that Johnny resides in, if he owns, is exempt from the asset test, but additional real estate properties do count. So we'll select that Johnny has a home here and click next. And then there's quite a bit of information that they're asking for. So does Johnny live in this home? So that's asking if this is Johnny's primary residence. Um, so you select yes. If it is not, you'll select no and then answer the remaining questions. So does Johnny's spouse live in the building? What is the fair market value of the home or building? Does he owe on it? You'll select whether or not the real piece of real estate is the address that you previously entered as his residence, or enter the actual street address for that property. You'll enter any additional owners, and so on. Okay, so this is just a quick note. This is not something that we are experts on here at our age option spec. But just important to know because it may come up and people may have questions about it, is that the state of Illinois can recover any money paid to those using AAB Medicaid after the beneficiary passes away. So this is typically only done for Medicaid recipients who are in long-term care and would result on like a lien on their property. This is rare. If you have any additional questions, we can direct you to our advisory team who had a speaker speak on this subject a few months ago, or find someone else who can answer these questions for you. Okay, so life insurance. So if your client has a life insurance policy, you'll enter information about that, whether it's an annuity, whole, or term policy. You'll select, enter the face value, and give some details on what the insurance company is, their address. And to note that the first $150 of the cash value is exempt from the policy, exempt from the asset test. Okay, so other additional resources. So if your client has other additional resources, you select which one it is. So the examples they have here is a mineral oil royalties, copyrights, tools or equipment, safe deposit box. This is really rare that you'll find someone who has these types of resources, but if they do, you'll enter that information here. Okay, so now on to income. All right, so if your applicant is employed, you'll select whether or not they have currently have a job or have had a job in the last 3 months, or if they are self-employed. It'll ask what the name of the employer is, details like their address and phone number, the applicant's job title. You'll state when they started the job and how much they get paid and their pay period. It'll ask if they are an hourly worker, if they receive payment, other payments such as a bonus, commission, or tips. Is the job ending or did it already end? And also for that backdated coverage month we requested for December, you'll enter the income for that month as well. Okay, so if they're self-employed, they have a few more questions here. So what type of self-employment is it? The date that they became self-employed, an estimation of how many hours of work hours a month they work, the gross monthly income, what are the business expenses? Okay, so tips for reporting self-employment. So be sure to fill out as much information as you and the client can. So important note is that self-employed individuals can deduct work expenses from their gross income in order to determine eligibility. So to just be sure to list expenses and claim those. Clients can submit self-employment ledgers to help document the expenses. They do not need to submit receipts as proof. Okay, so other income. So when they say other income, they're just referring to income other than employment income. So here they have SSI. They state it as RSDI, but that is Social Security Retirement, Social Security Survivors Benefits, or Social Security Disability. if they receive child support, if they get money for renting a room or providing meals, if they receive an adoption subsidy payment, or another type of income. Okay, so if you selected an other income, then you would enter in when they started getting payments, how often they receive payments, how much each payment is, and then if it's expected to continue. Okay, so additional information section. So at the end of the application, they'll ask if you have any additional information to provide. So you'd enter that into this box. Just some notes on how to use this section is to use this as an opportunity to highlight the important components of a case or an unusual situation that surrounds the person's case. Just to be sure to be brief and professional. This is not a place to tell client stories. And to provide supporting documentation as much as you can. Okay, so some examples of what you might enter into this box is if a job has ended, you'd want to put in the dates that it has ended. If they were anticipating a payout for like PTO or something similar. If this is a spend down application, if you'd like this to be considered for spend down. If you're requesting backdated coverage and you need to explain something additional about that. If it is a emergency Medicaid application, emergency Medicaid for non-citizens as well, or if there's just an unusual circumstance that you feel like the caseworker needs to know. Okay, so now we're off to submit. So this is what that'll look like when you get to this submission tab. You'll have some information to read to your client. And then you'll check off this box here to certify that they have read, understood, and accepts the penalty statements. And then you'll check off that you're signing off, you're electronically testing to the information and enter, if you're an approved representative, your own name, or if it's the client is in front of you, their name. Okay, so then I'll get the office information of where the application is being sent. They'll give you the phone number here. It is not an actual phone number to the exact office. It is for the IDHS hotline. Just be so you're aware you're not calling the exact facility. You do have the option to opt to send to a different office for whatever reason um, the client has. Okay, and then once you have submitted, you'll get a tracking number highlighted here in yellow. You'll also be given the opportunity to print the application. And then you can go ahead and click next for the next steps. So this is the next screen you'll look at. So this is not a list of required documents. It's just a list of documents that may be needed. So you can review that and see which ones are relevant to the case. And you can go ahead and submit that right away here. So enter the household member the proof is for, the type of proof it is. So that can be something like proof of address, proof of residency, the document type. So if it's a driver's license, an ID, and then upload the file. So we recommend when you're uploading documents with an application to do it within the next 24 hours, just in case you lose the ability to upload them later. So documents that you will always have to submit if it's relevant is a pension income, self-employed income, an unemployment statement, the green card for someone who is a legal permanent resident, and work income. So things that you may not have to upload, but you can, is proof of identification. They may be able to verify this in their own systems and they won't need for you to send in the document, but if you have it on hand, it's good to upload it regardless. Social Security income and medical expenses. Okay, so something that I like to explain to the clients once we finish the application is that they may receive what's called a verification checklist. So IDHS sends this to an applicant if they need additional documentation before they can approve the case. So an example here, they're asking for bank statements from the client. So the checklist will state who the verification is for in the household, the type of proof that they need, and the documents that they will be able to accept. I just encourage clients to act fast when they get these, to call me right away, so that way we can go ahead and upload it as soon as possible because oftentimes the deadlines are short. Okay, so part three, redeterminations and change reports. So what is a redetermination? So every year after a client has been approved for Medicaid, they'll need to renew their coverage or redetermine. So applicants will receive a physical form in the mail when it's time to complete the redetermination. Um, Sometimes you'll be required to submit updated income documentation as well with it. So applicants are renewed automatically if IDHS is able to verify their income within their system. If someone is renewed automatically, they'll get a letter letting them know that they have been renewed. So Medicaid recipients can complete the redetermination by returning the mailed form that they receive. They can also call the IDHS hotline and work with a caseworker over the phone. They or they may be able to submit through Manage My Case. So per usual, we recommend submitting through Manage My Case just so you have all that proof that everything has been uploaded and when it was completed. So in the management case, you'll see this. We do have a separate PowerPoint that we've sent with our toolkit that goes through how to set up management case, what's in each of these different tabs if you want a closer look. But the abridged version is that you'll see this button in the top left of the management case that you can click on. It appears within 60 days before the redetermination is due. And then this is what it will entail. So the form is typically auto-populated with the information that you entered at the time of application or in the previous reading. The confirmation, you confirm with the client that all the information that they have been presented is correct. If it's a spend down case, note that in the comments of the reading. You can go ahead and submit and upload any required documents if needed. Typically, sometimes these can take as little as 15 minutes to complete, depending on how complicated the case is. Okay, and once you submit the RED, you'll receive a application tracking number here and the opportunity to print the redetermination for the client or for your own records. Okay, so in between readies or whatever may happen with the case, you may need to submit a change report. So this is what you'll do if any major changes, like a change in contact information, a change in household, so someone moved into the household or left. There's been a change in household income if someone got a new job or left a job, any expenses or bill changes, any resources that they have come into or lost, if they have a change in health insurance, so like employer coverage, or any other changes such as like a case transfer you may be requesting, you can enter a change report for that as well. If any of these changes occur, you'd want to submit a report within 10 days of the change occurring. And then these should be processed within 30 days. Okay, so now some troubleshooting tips that we have just based on our own experience and what's been shared with us. I saw a message in the chat previously talking about workarounds for the iLogin system when you're getting a lot of errors. So in my experience, just clear your cache as often as possible. I found that this works a decent amount of the time. So I always clear my cache in between clients when I'm utilizing ABE. And something that I found works for me is to use a different browser in general for any ABE application than what I normally use, just because I'm frequently clearing out the browsing history and the cache just to avoid those error messages. Okay, so your session has ended because of an error. Sometimes we just experience glitches mid-application when working on ABE. Sometimes it permanently blocks you from the application, so you have to keep logging in or keep starting an application. Um, when this occurs, you can try logging into a different browser. Generally want to avoid using Internet Explorer. Like previously said, just clear the cache or possibly restart the computer if needed. If all else fails, paper application and faxing to central processing or the FCRC may work as well. Okay, whilst you're in the application, avoid using the forward or back button on your browser, like up here. You want to use the big blue buttons at the bottom, the next or back button, or else you get some weird errors. Sometimes I get caught up in a certain section of the application, so I may have entered something incorrectly. In this example, accidentally put in 0 for cash when I meant to put in however many dollars. So I progressed a few questions, realized I entered it incorrectly, tried to go back, and it wouldn't let me change the information I inputted. If that happens, if it won't let you edit, you can just keep moving to the end of the section till you get to the summary page, and it'll give you the opportunity to either change what you entered or erase it. Okay, if you're experiencing delayed applications, so IDHS is required to process Medicaid applications within 60 days of submitting. If an application has been pending for more than 60 days, you can request a temporary Medicaid card through the person's Manage My Case. In the event of a delayed application, there's a few different ways you can follow up. So depending on the issue, it's recommended to call IDHS hotline to get them to process it. You can also contact the magic email that we provided in your toolkit. So you can email them and ask for them to process the application. If possible, if you have the contact, you can contact the LOA for the local FCRC. Not always possible if you don't have that information. If you have a direct caseworker contact or it's someone that the client has spoken to previously and you have that information, you may contact them. Shriver Center's Help Hub is a fantastic resource. It is an online website where it's essentially a Q&A forum that has a bunch of local experts on Medicaid and Medicare who are available to answer your questions, provide their expertise. So that is also an option of who you may contact if you're running into issues. And if all else fails, worst case scenario happens, you need to file an appeal. And we have these outlined in the toolkit as well with some additional information. Okay, so if you just have questions at the end of this presentation and while you're working with clients, Rita and I are always available to answer your questions. If we don't know the answer, we'll talk to advisory. They have the Ask the Expert service where they provide free assistance for professionals who are enrolling people in Medicare and Medicaid. You can email or call them. They are very, very smart. So we also have the Shriver Center Help Hub, as I just explained, where you'll be able to connect with other application assisters and advocates who are experts. Okay, and just a reminder that your toolkit was previously sent. I'll send it again with the recording either today or later this week. You'll have the copy of the slide deck, the Medicaid household rules flow chart, and then some reference sheets that are just snapshots of certain slides we have shared with you today. And that is all we have. Does anyone have any questions? Alrighty, so if there's no questions, we can go ahead and wrap up. Like I said, we're gonna go ahead and I'll send you the recording after this presentation, either today or sometime this week, and I'll resend that toolkit as well for everyone who's attended. Chris, thank you so much, everyone.